When we say memory, it's actually a process, no? It's a process of everyone to first encode information that comes into the brain, and then after encoding, you store the information in the brain, and then when you need that information already, that's when you retrieve that information. So that forms yung memory process. So if there is any disturbances doon sa process na yun, then that's the time you'll probably have a memory disorder or memory problem. A lot of people may complain of having memory loss. It's not necessarily a disease or a disorder, but maybe it's a problem in one of the process nga of the memory formation. So that's why an individual can have memory loss or memory problem. One of the possible cause of memory loss is having dementia. So dementia is a general term describing an individual with cognitive dysfunction such as memory loss, problems in thinking, problems with their behavior that affects their daily activity. But most of the cases of dementia presents first with memory loss. We can have give tips to prevent dementia or to prevent memory loss. Number one is to have a healthy lifestyle. So how do we have a healthy lifestyle? So we need to control our blood pressure, manage hypertension, dyslipidemia or having high cholesterol. Even having diabetes is a risk factor for dementia. So we always have to address those vascular risk factors for us to avoid or to prevent development of subsequent dementia or memory loss. Tip number 2 is be socially active. So being socially inactive or being socially isolated to the community somehow makes your brain think less, or you use your brain less when you are isolated to the world. If you want to stay inside the room, if you don't want to meet with friends and you just isolate yourself, it's a risk factor for you to have memory loss. So to avoid memory loss, you have to be socially active. Tips can be, we can join organizations, join groups, interest groups, hobbies, and do activities with other people, or simple conversations with people outside the home can help you prevent or avoid memory loss. And the next tip would be you always have to continue to challenge your brain. So meaning you have to learn new things, learn new skills, develop hobbies, or even learn a new language. It's also proven that having higher educational attainment helps build your cognitive reserve. So comparing it to exercises a body, when we exercise in our body, we build our muscles. So by doing cognitively challenging activities, build the muscles of the brain. Hence, in the future, we have our store there and build its function, so we avoid memory loss. Tip number 4, involve yourself in dance. Dancing is one form of physical exercise that we advise. It's a physical exercise, but it's also a mentally challenging activity. So if you love to dance, continue to dance. If you don't know how to dance, learn and challenge yourself to learn how to dance. It's a way to prevent memory loss. Another is to look out for your mental well-being. So studies have shown that mental health issues such as depression or even anxiety is a risk factor for someone to develop dementia or a memory loss. So we have to identify and take care of our mental well-being so that the earlier that we have it checked, the earlier that we identify whether we have anxiety or if we have depression, the earlier it would be addressed accordingly. So again, it's a way to prevent further decline of memory. So a bonus tip, hearing and visual loss is an identifiable risk factor for somebody to potentially develop dementia. So we always remember to have our hearing and vision screened and checked, again, for early identification. So early identification of risk factors is a tip for us to prevent memory loss and subsequent development of dementia. So remember, memory loss can be a part of normal aging, but if you've noticed that you have frequent or more incidents of you having memory loss, this may be a beginning cognitive impairment, or there might be another problem that's causing the memory loss. So here in MakatiMed, we have the Memory Plus Center wherein we do neurological evaluation as well as memory screen that we can offer our patients for early identification and early management of memory problems.